Hi, this is Colin Reese, and he's here to help me out today. Today we are going to be doing a chest assessment just to check out to see how you're feeling, okay?
Okay.
Okay, the first thing I'm going to do is just to ask a few questions just to get a background.
Okay.
So, the first question is, do you have any issues with coughing or wheezing?
No.
Do you have a history of breathing problems such as pneumonia, bronchitis?
No.
Have you been experiencing any shortness of breath or problems with sleeping such as sleep apnea?
No.
Have you had any issues with chest pain?
No.
Do you have any allergies?
No.
Do you have any respiratory problems such as asthma?
No.
Have you had any surgeries in your chest or in the back area?
No, I have not.
Perfect. Do you have a family history of lung disease or cancer?
No.
Are you a smoker?
No.
Have you been around any environmental issues like chemicals that might affect your breathing?
Not that I know of. No.
Do you currently take any medications for breathing?
No.
Do you take any other prescription medications?
No.
How about anything over the counter?
Maybe once in a while ibuprofen, but that's it.
About how much do you take when you do?
I think it's like three little tablets of the normal, like the smaller stuff. I don't know exactly what the dosage is.
And do you take any herbal supplements?
No.
Okay, perfect. Okay, now that we're done, I got a little background on you. I'm going to begin the assessment. The first thing I'm going to do is just to look around to see how things are. Would you feel comfortable lowering your gown for me, please?
Yeah, sure.
Okay.
To here?
Yes.
Okay.
Or you can just take it like lower. Perfect. So looking at you, your sternum is midline, so that's good. When you breathe, I don't notice any deviations or anything like that. And looking at this, there's a 1-to-2 ratio between your diameter, so that's normal. That's good. The next thing we are going to do is I'm going to have you breathe, okay? Just breathe normally. And then not breathe normally. So the space between the intercostal spaces seem to be normal. That's good. That's a good sign. The next thing I'm going to do is to palpate. So I'm just going to be feeling to see if you're experiencing any tenderness or anything like that, okay?
Okay.
Do you have any pain?
No.
Anything like that? Okay.
One ticklish, that's it.
Okay. And now the next thing I'm going to do is check for your chest expansion.
Okay.
I'm going to place my thumbs right here. And then so I'm just going to have you take a deep breath in and out. One more time. Perfect. So, as you're breathing, my thumb's moving in and out the same distance, so that's good. So about 3 to 5 centimeters is normal.
Okay.
Now the next thing I'm going to do, I'm going to have you lay down onto your back for me.
Okay. Do you want me to keep this off?
Yes, please. And I am going to percuss on your abdomen a little bit, okay?
Mm-hmm. Yep.
So when I do begin this, I'm going to have you take a deep breath in and then hold it, okay?
Yep.
And I'll let you know when you can breathe back out. Okay. So breathe in, hold. You can release. Just gonna make a mark here. Okay. Now I'm gonna do that again one more time, okay?
Mm-hmm.
So breathe in. Okay, you can release. So this distance, about 3 to 5 centimeters between 2 marks. So that means things are good. I'm also going to do it on your left side. Okay, ready? I'm going to have you breathe in. Hold. Okay, release. Okay. And do it one more time, okay?
Mm-hmm.
Okay, take a deep breath in for me. Perfect, you can release. So the distance between is about 3 to 5 centimeters, which is what we would like. Okay, you can sit back up for me. so now the next thing that I am going to do is to percuss down your chest just to make sure that it sounds normal, okay?
Mm-hmm.
Okay, now I'm just going to put on my stethoscope and I'm just going to listen to your chest to see if I hear any different breathing sounds or anything like that, okay?
Mm-hmm.
So every time I put the stethoscope over you, I'm going to have you take a deep breath in and out.
Deep breath. Okay.
Perfect. Okay, now the next thing I'm going to do is I'm going to listen to your voice as you talk. So the first test I'm going to do, I'm going to have you say 99 as I repeat those steps, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Perfect. So for me, I just heard a muffled sound, which is good. Normally, when you begin to hear it clearer, there's usually that will signify to me that you have consolidation of some sort, which is usually not a good sign.
Okay.
But yours sounds perfect.
Okay.
And then the next thing I'm going to have you do is I'm going to have you say E as I repeat that, okay?
Okay. E. 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 E.
Okay, again, like the 99, we want to hear a muffled sound. When it begins to sound like an A, that's kind of a warning sign for us, and I did not hear that with you.
Good.
And then the last test I'm going to do on the front of your chest is I'm going to have you whisper 1, 2, 3. Okay. Perfect. Now, if you could you please turn around for me?
Sure.
Perfect. Okay. So now looking at your back, I can notice that your spine is straight, your scapulas are symmetrical, your shoulders are symmetrical. So that's it. That is good for me. Skin-wise, you don't have any moles or anything like that, just a few freckles. Like you don't have any family history of skin cancer or anything like that?
No.
Okay, so perfect. I can also notice that your ribs are pointing down at a 45-degree angle, which is like what we want to see.
Yeah.
let me know if you feel any like pain or tenderness. Okay? Any pain or anything like that?
No.
Okay. Perfect. Okay. So I'm going to put my hands on your back and I'm going to have you say 99, okay?
99. 99. 99. 99. 99.
Perfect. So that tells me like that your vibrations are lateral or bilateral, so that they're even, whatever. And as we went down, the vibrations decreased, which is good because you're getting down to the base of the bones.
Yep.
Okay. Now I'm going to check for your chest expansion. About here, I'm going to have you breathe in and out. One more time. Perfect. So that moved. So my thumbs, as you were breathing, they moved equally, about 5 to 10 centimeters. So that's what we were looking for.
Cool.
Okay. Now I'm going to percuss. So I'm just going to try to listen to see if I hear anything. Sounds good. Now I'm going to listen to your chest again. Okay, perfect. And now, just like you did on the front, I'm going to have you say 99 as I move down again, okay?
Okay. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Perfect. And then now you're going to say E.
E. E. E. E. E. E. E. E. E. E.
And then I'm going to have you whisper 1, 2, 3. 1, 2, 3. Perfect. And then you can turn back around and put your gown back on.
Okay.
And that's the end of our exam. I really appreciate your participation. I just want you to know that you sound very healthy and that's good. So keep doing what you're doing.
Thank you.